This is Mingo Kim from Carnegie Mellon University, and my presentation title is Low Intensity Transcranial Focused Ultrasound Modulates Pain Perception in Mice Models. In 2016, 50 million adults, which is approximately 20% of US people, have chronic pain daily or almost daily. So it is the leading cause of long-term disability, and the annual cost of chronic pain is as high as approximately $640 billion a year. Chronic pain has been linked to various physical and mental conditions as it is highly associated with quality of life. For example, people with chronic pain are 3 times more likely to develop depression and anxiety than those without chronic pain. So, for the chronic pain treatment, pharmacological treatments such as opioids have been used as low cost and fast acting pain relievers. However, due to unwanted side effects and increased risks of drug abuse, overdose, and addiction, there is a critical need to develop effective pain treatment methods without side effects, and therefore various neuromodulation techniques have been developed and used. Deep brain stimulation is well recognized as an effective treatment, and transcranial direct current and magnetic stimulation have been shown to be effective for depression and chronic pain management. However, due to the need for invasive surgical intervention, limited spatial resolutions, and difficulty to stimulate deep brain regions, there is a still need to develop non-invasive neuromodulation technology with a high degree of specificity and penetration. Transcranial focused ultrasound is a promising technique for non-invasive modulation of neuronal activity in the brain with high spatial resolution and deep penetration depth. Previous studies have provided evidence that TFOS can non-invasively activate or inhibit brain functions, control behavior-specific regions of brain, as well as theory of feasibility of treating neurological disorders. In addition, recently our lab provided a promising evidence of cell-type specific response to TFOS and long-term changes in synaptic plasticity. So building on the promising results with the use of TFOS, my research focused on modulation of pain-associated behaviors in wild-type and sickle-cell mice models by targeting pain processing brain circuits with various TFOS parameters. So my approach for pain treatment is to modulate pain perception by stimulating specific pain processing brain circuits rather than finding and stimulating each painful area in the body. Hypothesis is that TFOS stimulation can suppress or accelerate pain-related behaviors as a function of pulse repetition frequency values. To reach the objective of research, there are 4 aims, and let me demonstrate them one by one. The experimental setup consists of behavior tests, TFOS stimulation with multiple control groups, and video assessment with data analysis. Instead of pain ratings in humans, pain-like behavior such as licking, jumping, or kicking was assessed because this method is the most commonly used and reliable to quantify nociception in animal pain studies. And here is the TFOS stimulation paradigm. Basically, tone burst duration of 200 microseconds came from our prior study in set-type specific response to TFOS and to study the PRF effect related to excitatory or inhibitory effect. One value from a lower PRF and the other one from a higher PRF range was selected and used in this study. Here is the result about the effect of T4 stimulation on heat pain sensitivity in wild-type mice. Two figures show blinded test results on unilateral effect of T4 on nociceptive behavior by examining the difference of hind-paw withdrawal latency between sham and T4 treatment. To be specific, if T4 stimulation at left primary somatosensory cortex of the hind limb has effect on pain perception, longer right hind paw withdrawal latency can be measured than left hind paw withdrawal latency, which results in positive value of difference of HPWL. As you can see, the average difference of HPWL modulated by T-FOS at S1HL on male and female wild-type mice was significantly increased compared to the baseline value. However, the average difference of HPWL treated by sham treatment was not significantly different from the baseline value. So based on these results, T-FOS with a lower PRF at S1HL is effective for suppressing heat pain sensitivity in male and female wild-type mice. After obtaining modulatory effects in wild-type mice, we further studied the effect of T-FOS on heat hyperalgesia in sickle cell mice because this chronic pain mouse model demonstrates much higher thermal hyperalgesia than its control mouse model. So as you can see, the average difference of HBWL modulated by T-FOS with a lower PRF at S1HL in female sickle cell mice was significantly increased compared to the baseline values. In addition, by comparing the difference of HBWL at the same measurement time, negative average value was observed by T-FOS stimulation with higher PRF, and these values were statistically different from the response with a lower PRF, which means that T-FOS with a higher PRF can exacerbate thermal hyperalgesia in the sickle cell mice. Based on these results, T-FOS with a lower or higher PRF at S1HL is effective for suppressing or promoting heat hyperalgesia in female sickle cell mice. So after studying the effect of T-FOS at the pain processing brain circuit on Knox's painful heat stimulation, safe evaluation of T-FOS stimulation was conducted with Rotarod test because it is widely used to evaluate motor functions and coordinates. So as you can see, compared to the latency to fall from baseline value, T-FOS at left S1HL didn't induce significant changes on the latency to fall in female sickle cell mice. Based on these results, T-FOS with a lower PRF at S1HL didn't induce significant adverse effect on motor functions and coordinates in female sickle cell mice. To sum up, based on key findings in this presentation, a single session of low-intensity T-FOS stimulation at the specific pain processing circuit results in a significant change in pain-related behaviors evoked by noxious heat in wild-type mice and well-established chronic pain sickle cell mice model. Based on these results, T-FOS stimulation can be applied for modulating pain sensitivity in chronic pain by targeting specific pain processing brain circuit with high specificity, which can be translated to clinical application. So here are our funding sources and our collaborators, and thank you.